Hi, my name is Mark Butterworth. I'm the Principal Chiropractor at Headingley Chiropractic Clinic. Thanks very much for joining us for this short video today on neck and back pain. We understand that these pains can make it very difficult, uncomfortable, or sometimes even stop us doing the things we want to do, be it going to work, looking after the kids, or even just doing the sports and pastimes that you want to do. And we're here to help you with that. This short video will talk about how you get these pains, what you can do to help yourself, and how you can stay better.
Let's start by talking about how we develop these pains. Now, while it's true in a minority of cases that the pains may start through a significant trauma such as a fall or a motor car accident, in fact in the majority of cases the pains start with a minor or everyday activity, such as bending down to do your shoelaces up or reaching out for something. The physiological adaptive range helps explain this. Now, we all undergo a certain amount of stress and strain from day to day, be it through poor posture, not lifting correctly, not getting enough exercise, and just the emotional and psychological strain of everyday living. Now, that's all okay as long as your body recovers and you wake up the next day ready to go again. However, if you carry some of that stress and strain over to the next day, and that happens again and again, we get a gradual accumulation of the stress and strain until we reach a point of maximal adaptation. This is the breaking point, and it really doesn't take much to push you over the edge. So like the straw that broke the camel's back, it's often some minor activity. As we said before, perhaps even just bending down to tie your shoelaces up. And that's the point at which the body says, enough, I can't cope with this anymore. And it tightens and locks the joints up to protect that area. The muscles tighten, and that's when we get the pain. What can you do when you get that pain? Well, one of the things you can do is put ice on the painful area. Make sure that you've got something between you and the ice pack, say a tea towel, and put it on several times a day for say about 30 minutes at a time. Keep active, such as walking, and make sure that you're not resting, for instance lying on your back for long periods of time. Avoid strenuous exercises which hurt. In other words, don't try and push yourself through the pain barrier. And avoid postures and activities that hurt. So we talked about walking, and if walking and striding out causes you discomfort, try shuffling. That might be a bit more comfortable, but it still keeps you moving. Now, there's several therapies that have been shown to be more effective than others as far as lower back pain. The National Institute of Clinical Excellence, the major advisory and research body for medical healthcare professionals in the UK, has determined several therapies to be effective. One of those is manipulation and mobilization of joints, particularly the spine. Now, chiropractors are experts in this area, and we work with people from day to day to help them to help loosen off the joints and alleviate the pain. Another therapy is massage of muscles, and chiropractors routinely integrate that into their treatment as well. Now, at Headingley Chiropractic Clinic, we have studied a popular postgraduate advanced technique called sacro-occipital technique. Now, while this technique is best known for its cranial work, it also involves detailed analysis and corrections of the pelvis, extremity, visceral system, and the muscular system. So what that effectively means is we have a look at you from head to toe and tailor our treatments so that they're individualized to you. Some other things that also may help are exercises and self-help advice. From day one, we give you a questionnaire and we determine what the areas of your lifestyle that may be causing you stress and strain on your back and neck. We'll then give you individualized advice on how you can improve on these areas, and then coach you through making those changes. We also have a healthcare class because education on how to help yourself has been shown to be very, very important. And in that class we cover things such as exercises, stretches, posture, etc. And we talked about lower back pain, but let's talk a bit about neck pain. The most exhaustive and authoritative study on neck pain is the Bone and Joint Decade Task Force on neck pain. And it pretty much had the same conclusions as the NICE guidelines on lower back, in that manipulation and mobilization of the joints is effective, massage is effective, so education on how to help yourself, and prescription of exercises. Let's talk about some of the things that can cause you strain on your back and your neck. Sitting is probably one of the primary ones. It's really important when you sit in the chair in the office that you take a correct posture. And that posture should be that the angle of your hips to your thighs should be 90 degrees or even greater. You should be looking straight ahead, and your elbows should be at 90 degrees and well supported. It's important that you take regular breaks, so that means just getting up every hour or so, walking around and stretching out. As far as the screen height goes, the screen generally needs to be lifted, but certainly to the point where you can look straight ahead and see the screen without having to look downwards. As far as using a laptop, a docking station is ideal. Failing that though, it's a good idea to use some books or a dedicated stand to lift the laptop up so the screen is at eye height, and then perhaps to put a keyboard and a mouse into the USB port, and thus converting it into a PC type format. If you're on the phone for long periods of time, that can also cause quite a bit of strain on your neck and shoulders, particularly if you have the shoulder crooked between your neck and shoulder, and the phone between your neck and shoulder, and you're writing notes. A way around this is to use a headset. Sleeping is another area where you can cause strain, and it's important to get the pillows right here. Ideally, whether you use an orthopedic pillow or a standard pillow, although an orthopedic pillow does make it easy to achieve what we're about to talk about, it's important to make sure that your mid-back and your neck make one straight line when you're lying on your side, and on your back it's important to make sure that you can look straight up at a point directly above your head. Also important to remember that sleeping on your stomach is not a good idea. That often involves you having to twist your neck in a certain direction, which is neither good for the neck or the lower back. Now, while many of you may be familiar with lifting technique, I'll just go through that quickly now. It's important not to bend from the waist, but however to grasp the object and pull it close to you, and use your knees and hips to lift. Another important topic to go through is exercising. Now, before we actually do the main exercise, it's a good idea to warm up. Now, static stretching, where we hold a certain position for a period of time, is not a good idea. It's shown to be detrimental to your performance. Dynamic stretching, however, is a much better idea. Dynamic stretching is where you go through the motions that you're about to do following the stretches. So, for instance, if we're playing golf, it would be a good idea to swing your arms and hips in the direction that you might do if you're swinging a golf club, and then progress up to actually getting the golf club and swinging through a few motions, but keeping it all very loose and light and easy, and then going on from there to the main exercise. As far as exercising goes, it's a good idea to do whole and core body exercises, which we'll go through in just a moment. At the end of our stretching, that is a good time, however, to do your static stretching, where we, as I said before, we hold the stretch for a period of time. 20 to 30 seconds is generally acknowledged as the best or optimal time to do that. Now, some of the exercises we can do include using the cross trainer, swimming, as long as it's not breaststroke. Breaststroke is not good for your hips and your back, particularly not good for your neck if you hold your neck out of the water. Another exercise to do can be walking. Now, there's all sorts of exercises you can do, but have a chat to your chiropractor and they'll be able to take you through the ones that would best suit you.
Hopefully from this short video, you will have gained insight into your back and neck problems. In particular, how you develop these pains, what you can do to help yourself, and what we can do to help you. Now, after this video, there's several various options you may choose to do. One is just to contact us for a brief chat, and our contact phone number is 0113 228 9888. Email us at info@headchiro.com, and Head Chiro is spelled HEADCHIRO. Or come in for a free screening and we'll give you a brief examination, talk to you a little bit about how we can help you if we can, and some advice on how you can look after yourself. You may also want to come in for an initial examination, in which case we'll go through a thorough orthopaedic, neurological and chiropractic exam, and most times a static SEMG scanning of your spine. So thanks very much for joining us once again, and I'll look forward to hearing from you or seeing from you soon. Thanks very much. Bye.